welcome to our special coronavirus show. I'm Anjali Istwal. In this show, we separate fact from fiction. And in today's show, we have a special guest joining us from all the way from America, Dr. Purushottam Rao Tata. He is a cell biologist with the Duke University in North Carolina. He's leading a study that has created mini human lungs and are now studying COVID infection in real time by infecting those lungs. But before that, let's take a look at the headlines. Increase in COVID-19 cases in 5 states during festival season. 58% of the fresh COVID-19 cases in the country reported from Maharashtra, West Bengal, Delhi, Chhattisgarh and Karnataka. Responding to a question over the BJP's election manifesto promising free coronavirus vaccine for everyone in Bihar, Dr. V.K. Paul, who heads the National Task Force for COVID-19, says state governments have been urged by the centre to take a national approach towards the vaccination. Delhi records its highest daily cases ever, 4,853 cases in 24 hours. Last time Delhi crossed the 4,000 mark was in September 19th. Deputy Chief Minister says schools will remain shut till further orders. Pfizer's measured optimism over coronavirus. It says it could supply some 40 million doses in the United States in 2020 if clinical testing proceeds as expected and regulators approve a vaccine. Scientists grow mini human lungs in a lab, infect them with coronavirus and watch the damage done by the virus in real time. This research could help understand the virus and to test drugs like remdesivir at large scale. So today first we are going to talk about the Delhi situation, which seems to be worsening. Now Delhi has recorded its highest daily cases ever. 4,853 cases in the last 24 hours. The last time Delhi crossed the 4,000 mark was on September 19th. As you can see from the graph, it seems that Delhi is now heading towards a third wave and possibly a more stronger wave. We have seen in the last 2 waves that the subsequent wave, the wave that comes later, has had a more lasting impact. So we are worried about this fact now. Could Delhi be heading towards a situation which could get worse as we see a jump in the daily numbers? To talk about this, we have Dr. Arvind Kumar joining us right now. Thank you very much, Dr. Kumar, for speaking with NDTV. If you look at the numbers that Delhi is registering right now, it is quite shocking, especially since Delhi has always claimed the fact that we are very careful as far as coronavirus is concerned. But festival season or no festival season, these are big numbers for a small city.
Yeah, true, Anjali. The numbers are shocking. So I am shocked by the numbers, but I'm not surprised by the numbers. And I'll tell you why I'm not surprised. The way general a message has been going on that, things are improving, things are coming under control. Being in a hospital, I have access to and I talk to a large number of people, and I'm just feeling that there is a sense of complacency which is developing in people that, oh, now it's slowly, numbers are decreasing, numbers are getting over. So there is a decreasing adherence to the 3 known principles. That's number 1. Number 2, we've just finished one major festival season, and we have many more coming in the coming weeks and months, which also led to a large number of people coming together for various activities. And 3, a more deadly thing which is developing side by side is that if you look at the number of PM 2.5 levels, PM 10, NOx, SOx and all other things, the pollution is on the rise and will continue to rise in the coming few weeks, which world over the research has shown that it has a deleterious effect on the incidence as well as mortality. So complacency on the part of people, increasing mixing of people because of the festival and other reasons, and increase in pollution. I think these 3 things together are leading to the rise in the cases. And as a doctor, My biggest fear is that as these three increase further, we should not be heading for the biggest spike that we have seen till now, because that will be really, really bad for the city and for the people.
Right. Doctor,
Anjali.
you've mentioned pollution. And, you know, pollution is something that on NDTV we've been continuously talking about, and how in this pandemic era, this has become a double whammy, and you are mentioning that. There are studies also that are showing now not only is it linked to increase in deaths, but also the fact that the PM 2.5 particles could be like almost like carriers of coronavirus.
Yeah, Anjali, so there are two types of studies which have come. One which have looked at the incidence of COVID in pollution affected communities, and the other are the studies which have looked at death rate in those who get affected by COVID in the pollution affected communities. So there are studies from China, there are studies from Italy, from various other European countries, which have clearly, categorically shown that areas which have high numbers as far as PM 2.5 are concerned have a higher per unit population incidence of COVID. And one of the theories which has been suggested is that the COVID virus gets latched on to the surface of the particulate matter. It gets adsorbed there on the surface. And when the particulate matter goes and PM 2.5 goes deep into the lungs, the virus piggybacks on the PM 2.5 and reaches deep surfaces of the lung and infects there because it gets to stay there. So this is one. We have higher chance of getting COVID. More important is the Harvard study, which has shown that 1 microgram increase in the chronic exposure to PM 2.5 converts into roughly 8% increase in mortality, because the factors are common. The pollution adversely affects your lungs, your hearts, and other organs. And everybody knows that people who have these organs affected have higher mortality with COVID. So it's not rocket science. It's very easy to understand that pollution impacted people have higher chance of getting corona, and after that they have higher chance of death. And that becomes very, very important that all across North India, all of us, government and people together, do everything that we can to keep the pollution levels under control so that this corona problem does not go out of hand. Anjali.
Right, absolutely right, Doctor. And now the orders are coming in that schools won't open, and people are being requested not to step out early in the morning and late in the evening. But how long can you avoid the pollution? We have to reduce the pollution levels. That's absolutely correct. Thank you very much, Doctor, for joining NDTV for this. We expect that Delhi might be able to control its numbers soon as the Delhi government takes note of this spike.
Thank you, Anjali.
Moving on to other news, a team of Duke University researchers have developed a lab-grown living lung model that mimics the tiny air sacs of the lungs where coronavirus infection and serious lung damage takes place. Now, this advance has enabled them to watch the battle between the SARS-CoV-2 coronavirus, which is the novel coronavirus, and the lung cells at the finest molecular scale. The virus damages the delicate balloon-like air sacs known as alveoli, and it leads to pneumonia and acute respiratory distress, which is the leading cause of death in COVID-19 patients. In 6 hours, cells begin to produce interferons, which are proteins that act as warning signals or alerts to neighboring cells. After 48 hours, the cells start fighting back, and after 60 hours from infection, some of the alveolar cells begin to disintegrate, leading to cell death and damage to the tissue. And all this, the visuals that you are seeing, has been recorded live, real time in these sacs of lungs. Now, joining us right now is the leader of that team, the doctor who has infected these who has infected these alveoli and has found out how exactly it works. With us is Dr. Purushottam Rao Tata. Thank you very much, Doctor. Let's begin with what are the findings of your study? What have you seen?
Yeah, sure. So my lab at Duke University School of Medicine is interested in understanding the lung diseases, especially that occur due to the damage caused by various agents, including viruses. So along these lines, what we have been doing is, this work started even before the COVID started, the pandemic evolved. We have been working on developing a humanized model system. What I mean by humanized is, so far in the research, we have been using mouse models and some cell lines that are derived from different sources, like some non-human primates, including some monkeys and other things. But one big caveat with these model systems is they do not represent a human model system. So for this, what we did is we took our own human lung stem cells. So stem cells are, one can put this way, these are the building blocks of our lung tissues. When there is damage, these stem cells can sense that, they repair the damage. And what we did is we took the same property, the ability to repair them. We took these stem cells and we provided a right cocktail so that they can strive outside our body. And that's where our work came into picture, because we developed this recipe. This recipe doesn't just simply come in. It's like a cooking. You have to add the right ingredients to get the right composition. And by doing that, we are able to now recreate a mini lung outside our body. And these mini lungs are now very valuable because one important thing again is the COVID virus, strikingly, it actually infects these stem cells. So now we have a mini lung model outside our body where we can test the COVID virus infection and watch it lively, what actually happens in these tissues or in this infection.
Right. Dr. Tata, apart from understanding how the disease works and how the virus works, will it help studying the effect of not just the disease, but also the medicines that we are talking about as cures, the drugs, and also in developing the vaccine?
Yeah, that's a great question. So, as you said, this is useful for understanding the disease mechanism, what actually happens in the disease. But also, more importantly, it allows us now to test drugs using this model system. So what we can do is not only we can test the existing drugs. For example, there is remdesivir and many other drugs that are being tested that we can test in these mini lungs outside our body. But also, we can discover new drugs using this system. So being able to do these experiments outside our body gives us the ability to scale up the system, meaning we can now test large number of the candidate drugs outside our body. And that's where we have some upcoming studies coming up, testing some drugs in this model, and we are really excited about it.
That's absolutely great news, Dr. Tata. But what about the thing that we keep talking about, the long-term effect of the virus on the lungs? We have seen even in India, people coming back after being cured and coming back and saying that there is some problem, and then them later being put on oxygen.
Absolutely. So that's where actually my actual interests are in my lab. So what we do is we look at the aftermaths of the damage. So when viruses or bacteria, anything infects our lung, we study what happens afterwards so that we can help better heal the lung tissues. And in this case, this mini lung model that we developed is very valuable because when these viruses infect the lung cells, we have the kind of window of opportunity to energize these cells so that they can heal better. And that we can now test in our mini lung model.
Right. So all this study that you've done, you've seen the coronavirus infecting a lung real time. After this, what is it that you found is unique to this virus? What is your key finding?
This coronavirus, as the name says, it belongs to a large family of coronaviruses. It's a newly evolved variant of one of the coronavirus strain. And so we know a little bit from its sibling, that's called coronavirus 1. This is a coronavirus 2. And coronavirus 1, we call it, in scientific terms, we call it SARS-CoV-1. SARS-CoV, current one is SARS-CoV-2. They look very similar, but the way it is infecting, the way it is causing damage to the lung cells, especially the lung stem cells, is slightly different from its sibling. And we are still figuring it out. And one of the findings we have from our study is it induces a cytokine storm. So what it means is when the virus infects these lung stem cells, they produce large quantities of some molecules. These are proteins, and these proteins themselves are toxic to our lung cells around the damaged areas. So that's where the real problem is coming. So we are working towards suppressing those cytokine mechanisms that control this cytokine storm. And again, this is something unique from what we have seen before in the field with other viruses.
Right. Thank you very much for speaking with NDTV, Dr. Tata, and best of luck for your study. Well, we're going to take a very quick break now. When we come back, we answer your questions, and Dr. Parv Mittal joins us to do that. Welcome back. You're watching the Coronavirus Show, and now it's time to answer your questions. Dr. Parv Mittal joins us. He is Vice President of Federation of Resident Doctors Association. Pardon me. Thank you very much, Dr. Parv, for speaking with NDTV. Let's take the first question that's been sent to us.
Yeah,
Hi, my name is Aryan, and I'm from Delhi.
Happy to
and my
have
question is, how can one find if they have had coronavirus?
Well, doctor, the viewer wants to know if they can find out if they've had coronavirus.
So again, if you need there can be certain clues and there can be certain hints as to find out whether you have had coronavirus in the past. This is a very common query that people have, because in the past few months, people have had episodes of, 3-4 days of fever, and then it has subsided. Everything has settled down. So this is a very common query. A common way to find out whether you have had coronavirus in the past is to get your antibodies tested for COVID-19. There is an antibody test which includes IgG and IgM. And IgG levels would indicate that you have had infection in the past and you have developed an immunity to it as well.
Right. Doctor, let's take the next question that we've been sent by our viewer Piyush.
Yeah, sure.
Hello, my name is Piyush Joshi and I'm from Mumbai. And my question is, when do we reach herd immunity and how much of the population needs to be infected? Thank you.
So again, the concept of herd immunity has been floated around by many people, and herd immunity has been vouched to be a particular solution to the COVID pandemic. But again, the concept of herd immunity does not strictly apply to the solution for COVID-19. Herd immunity is for a closed population, not for an open population where in a particular area people are coming in and going out. So firstly, per se, herd immunity concept does not strictly apply to as a solution or a panacea to COVID-19. As far as the other question is concerned, the question about the percentage of population who are infected, it should be more than 50% at least. More than 50% population needs to be infected in order to give herd immunity to the uninfected individuals.
Right. Also, doctor, wouldn't India be too vast and too varied with its numbers and infection rates for us to now consider herd immunity? So
exactly, that's my point, Anjali, because India, and for that matter, any other country who is not in a strict lockdown is an open population. So
Right.
people come in, they go out. So naturally, we do not have the same set of people living in a particular place, and only in such a situation can, immunity be derived from those people.
Right. This is probably a
long as-
solution that small islands usually work on. Anyway, thank you very much, Doctor, for joining in. Thank you very much for speaking with NDTV.
Thank you, Anjali. Thank you so much.